This is the MRI scan of a 35-year-old male who dislocated his shoulder 10 years previously snowboarding. He's had multiple instability episodes since then. The MRI scan demonstrates a large tear of the anterior labrum with stripping of the periosteum at the front of the glenoid. Intraoperatively, once a GA has been given, the shoulder is seen to dislocate easily. You can see how unstable the shoulder is. It easily dislocates anteriorly and reduces. You can see dislocation, reduction. So you can see how unstable the shoulder is. This is inside the shoulder. The anterior labrum has fallen off the anterior margin of the glenoid. The tear extends superiorly underneath the biceps tendon. The MRI scan shows the biceps tendon tear, which is seen intraoperatively. The labrum is then elevated at the front of the glenoid. The labrum is stuck down in the wrong position and needs to be elevated so the position of the labrum can be corrected. The burr is then brought in and the anterior margin of the glenoid is abraded to provide a healthy bleeding surface of bone for the cartilage to heal back onto. The bone underneath the biceps tendon insertion is also abraded so healing can occur here. The next step is then to introduce the anchors. The cannula for the drill is introduced and placed at the most inferior margin of the glenoid for the first anchor. This is the drill being brought in and preparing a hole for the anchor to go into. You see the anchor is the white tip of the introducer. This is then placed in position and then hammered into position with a mallet. You can see the anchor going into position with the bone and the laser lines are matching. The introducer is then removed, leaving the sutures behind. These sutures are then used to tie the cartilage and the capsule to the anterior margin of the glenoid. You can see this hook is a hollow hook. It brings in a passing suture, which is taken through the capsule and under the anterior labrum. You can see the hook coming out underneath the labrum and the passing suture, and one of the sutures attached to the anchor are then retrieved, and then that suture is then passed back through the tissue so that it can be tied. You can see now 3 anchors being placed, the labrum is back in position, and attention is now turned to the biceps tendon. You can see the anterior suture in place, and then tied, and then the posterior biceps anchor being positioned. The passing device is then taken through the cartilage to this point. The passing suture is then brought into the joint, and the passing suture and one of the sutures attached to the anchor are retrieved. They're tied together and then passed back through the tissue so that the bicep tendon can be tied. You can see here again the completed repair with the cartilage being repaired. There are 5 anchors in total. You can see the biceps tendon repair there, and again the anterior labral repair with the biceps tendon superiorly being repaired.